details with the actually a ganglion cyst on your wrist.
Right.
That they say, you know, hit it with a book and it'll pop and go away. And with a ganglion cyst, that's a different thing. It doesn't really have a capsule. It's just, it is like the lining of the joints in your arm, in your hand, you know, around the bones. That little tissue that lines the joints just makes kind of like a little bubble. And then it fills up with joint fluid, and so you have like a little bubble. I just got a hair along with. That's all the reason that hurt. I was picking up the thread.
It didn't hurt. It just surprised me.
I bet. Well, I was picking up the thread, and it's like, oh, and then something popped. It's like, whoops, I got a hair with it. So those, it was like, yeah, hit it with a book is the old, and almost anybody over 65, if you know, over 60, even if you say ganglion cyst, they say, I know what you do with those. You hit them with a book.
Right.
It was the old.
That looks pretty good.
Yeah, it's just about set. A little tiny piece of connective tissue there will get out of the way, and there's that piece keeps wanting to kind of pop through that. That was just attached to the lipoma, and that's why it's kind of loose there.
Now, because it's a lipoma, are you going to send it for testing, or you know that's what it is?
You don't need to. Yeah,
okay.
It looks a lipoma. Nothing else it can be.
Well, since I have a lipoma there, is there a pretty good chance that the rest of it okay.
Absolutely, yeah. And that's what they looked like even before I started, was a lipoma, because it wasn't firm enough. You know, your little sebaceous cysts are more firm and so just 2 little stitches and we'll have you tied up good as new. And
now, do I come in for removal of these, or? Okay.
Yeah, they should stay about 7 days.
Okay.
And then we can get them out next Monday. I always tell people if I'm going to stick in there is just that little edge is gapping just a tiny bit, which would probably heal just fine. I don't want to leave you with a scar any bigger, that one little end. Oh no, that should heal. I don't think we need a third one. Changing my mind back and forth here. That yes we do, no we don't. It's like, what's going to give you the best scar? I will make sure that last little part stays together. You know, with the suture removal, it's just like a straight round stitch with a knot in the top. So I always feel like, you know, if everything looks 100% perfect, you're not worried about it, it's not red, it's not infected, it's healing, not sore 7 days from now, we can certainly have you come in here and get the stitches out. But again, if you're going to have to make that big drive from work and everything else,
I'll come in here.
It is a very safe thing. You just pull up the knot, cut one side of it, and pull it out.
I'll come in here.
Okay. Some people feel like, yeah, I don't want to touch that. Other people feel like, oh yeah, if that's all I have to do, I'm not driving.
Just in the off chance it's something, I do something crazy, I'm definitely coming here. That's you guys get paid.
No problem. We can certainly get that out.
Well, it's so weird to see my arm without a bump.
Really? All acting normal and.
Yeah, that's so weird.
Yellow stuff we have on it. And you can see that little white circle around it. That is from the local anesthetic that has epinephrine in it. The epinephrine causes it to vasoconstrict so that it doesn't bleed as much. So you get that little white thing where you're not getting as much blood to the tissue.
My skin naturally does that anyway. I mean, not as much, but like I have like I think poor blood circulation, so I can make a mark on my arm and it stays white for like a minute or two. It's very weird.
Good. And then the other thing, because that had like the little hole under it, and you know when you look at that tape there, you can see kind of as I'm pulling up the skin, there's kind of a hole under it. It really needs kind of pressure over it to, you know, heal it down so that it doesn't end up with a.
Okay. So you're going to tape it tight, or I need to hold it for a certain amount of time?
I'll tape it tighter and put a little pressure dressing on it, and if I can get it to not stick to my glove. Yeah, not the prettiest dressing you've ever seen, but
Yeah, it's a good story.
it'll hold it down there. You see, they train nurses in nursing school to make pretty dressings. Doctors, we just kind of have to. The worst is when we do toenails. I always go, hey, there must be a better way to put a dressing on a big toe, but there. So I would leave that dressing on it for minimum of probably minimum of 8 hours. Better if you leave it on until morning.
Okay.
And then you would take that off, and after that, put a Band-Aid on it.
Okay. Can I sit up or?
Absolutely, yes. Make sure you don't feel dizzy or lightheaded, especially after watching it.
Yeah.
And then, if you want to film the lipoma that we took out.
Oh my goodness.
All those pieces right in there.
Just that stuff? That was the big chunk in my arm?
Yeah, that's all little pieces of fat tissue that came out.
Wow.
And you can see there's no firm areas in it. It's all just plain old fat tissue, nothing else. So it's clearly a lipoma.
Okay. Thank you.